My name is Dr. Russ Farmer. I am a colorectal surgeon here at the University of Louisville. I'm also the Senior Associate Dean for Undergraduate Medical Education and Curriculum. I graduated from the Master's in Health Professions Education program in December of 2022.
Hi, my name is Dr. McGowan. I am a student of the MS HPE program at the University of Louisville. Go Cards!
By receiving a Master's in Health Professions Ed, I have gained innumerable skills, innumerable techniques that I can employ on any given day as a clinical educator. Additionally, I have established myself as the go-to person in my department for matters about education. It helps me distinguish myself as someone who is the expert in this field.
I decided to enroll in the MS HPE program because I felt, although I'd been taught to be a good clinician during my medical school and residency training, nobody had ever taken the time to really teach us how to be effective educators. We were so busy learning how to be good doctors, we didn't learn how to be educators. When I got comfortable in the setting of seeing patients independently and working as a clinician, I realized that I didn't have the skills that I desired to really teach the next generation of healthcare professionals in an effective manner.
Taking an online class was relatively easy. I would work a normal clinical day or an academic day, depending, and I would come home and have a normal day with my family and then spend somewhere between 30 to 60 minutes a couple times a week working on things just in my free time. And then I'd spend a little bit of extra time on the weekends, maybe an hour or two, going through the additional work. Sometimes a little bit more, sometimes a little bit less, but on the whole, I would say that the program works very hard to distill the cogent facts and topics down to digestible bites. It's really geared toward people that have a busy clinical schedule and want to be better teachers.
The online classes in the HPE program are great because it really allows for us to work asynchronously in relation to our clinical duties and our administrative tasks. It makes it much easier to do a full master's program while still being a full-time employee. So for me, I work shifts in the emergency department, so I might be working a day shift, an evening shift, or an overnight shift. What I love about the asynchronous nature of the program is I can fit that material in whenever I have time. So if I'm on an overnight, I might be able to get some of my readings done on shift. If I'm on mid shifts, I might get things done in the morning. It just makes it very easy to fit the assignments into what my schedule allows. The students in the HPE program are all different, but one thing we have in common is that we all are busy clinicians with a full-time schedule outside of the classroom. That's one thing that's so nice about this program, and it allows for you to do all of those things as well as still be a student.
There is no mandatory part of the online HPE program. We do provide optional components of that, but this is an exclusively asynchronous online program if you choose. Because we know clinicians are busy, we aim to make this program completable on your own timeline. We're often flexible with things like due dates and timelines, so this is really all about you and your learning, and we're here to facilitate that.
Students choose to enroll in the HPE program as they're trying to learn how to be effective educators, become more involved with program design, curriculum restructuring, or to get involved with HPE research. I find that most of the people that I've interacted with in the program are like me. They felt they're good clinicians, but really want to learn how to pass that knowledge on and how to teach in a more effective manner to their learners. After I graduate, I want to continue to use the skills I've learned to help further our curriculum in our residency program and with the medical students I teach. I've really liked that the things that we're learning in the program are applicable that we can apply immediately, so I'm already finding ways to integrate that with the daily activities clinically as well as administrative tasks on the academic side.
A Master's in Health Professions Ed has helped me define my career as an educator and helped me feel more fulfilled in my bedside teaching every day.